Hello, everyone, and welcome to another uh, at a monthly at a mental health at a video. With it being a mental health at awareness month, I wanted the topic uh, for this month's video to key in on different types of therapy and other resources. Um, so yeah, kicking off with therapy. So like I know that you may have access or you may not have access to like different types of therapy groups. Um, so uh, there's life skill groups where you touch on like the way that the mind like works, like in regards to like different things where you're able to like pick up on different ways of thinking um, that very well may not actually be like based in reality, um, where we for instance, like if we think because that this one thing is bad today, right? So then when we come back to like, well, it was bad yesterday, so it's always gonna be bad. It's gonna be bad now. I mean, okay, um, yeah. So there's like already like that built in, like view of like what's gonna happen when the actuality is you don't actually know. You don't know if this may be like the one time where it actually works out. I mean, you don't know. But if you go into it thinking that it's gonna be bad, or if you go into it, expecting that it's gonna be bad, odds are it's probably going to turn out bad. Not because it was meant to turn out bad, but because your mind was already set that way. Um, yeah, so that's one thing that life skill groups can actually like allow us to like notice and to like work on. Um, so there are also like other groups where it's like a trauma based group, or it's more like I guess like at out a patient of like a therapy where you meet up like every day, and you guys learn like a new skill, you know. With that, you set like a goal for like a week. Um, I mean, you might even, like, learn how to get like more in tune and with what your like emotions like are. I mean, like I know that in my group, that we would come into the room, and everybody would like go like around the room, and we each had to state what our current emotion was like coming in, and give it like a number on like a scale of 1 to 10. A 10 being, yeah, I feel really great, and like one, I guess, being, yeah, I'm just not here today, right? Um, yeah, so there's that. Um, and then when we would like in the group, we would have to give like what our emotion was. At the end, and then also again like a rating. Um, now that what that what I did, and I'll touch on this, I guess, at the very like end of this video. It's like I worked on like a chart that can be used on like a daily basis, like a weekly basis. It could, it can be used like digitally. Um, you know, so a way that you could, like essentially like on your own, try to keep like an account or like a record of what your emotions were for each day. Like any like thoughts that you had like with that. But I'll go into that more so later on. Um, so anyway, um, then there's also talking one on one with a therapist, which I've done uh, a lot of actually. Sometimes like it's good to have like a one on one so that a way that you can key in, and like focus on certain like problem areas. Um, and then also DBT, which um, is like a form of behavior therapy. Um, like so that when that I come on here, like, and I'm like talking about what I did for like a therapy that we was working on. Yeah, it comes from that. Um, I mean, through that, like you learn like different skills such as like mindfulness, um, such as learning to problem solve, and to think your way through like a certain like a moment or like issue, you know, um, different ways to bring your emotion level to like a more like a manageable point, so like you're not like always at like in 80, like, and by 80, like I mean like you're almost at like 100, and 100 is when you like low, right? um so yeah, so but just like learning like different ways, to like manage that. And then you have CBT, which is cognitive behavior therapy. I'm pretty sure that I did this at one point or another. Um, I just don't remember when, so I can't really speak on what I gained from it. Um, but it wouldn't hurt, just to like go look into it, see if that's something that could be of benefit for either you or someone that you know who's dealing with an awful lot. Yeah, no, especially if it's a lot of trauma, you know, like I think that that would be, you know, like of a, like a benefit, you know, like everything that I'm like bringing up, um, you know, like in this like a video, you know, like I think, you know, it could be like a benefit, uh, to uh help out someone else. You know, I mean, it doesn't mean that everything I listed that is gonna work. No, because it's on like a case by case basis. That but what at a form of a therapy works out for like a one person, it may not work out for the other person. That's just the way that it happens to work. You know, I mean, it might not make like a whole lot of sense at times, but you. But I would say to don't like a give up. You know, like if that one form of therapy, if it doesn't work, okay, stop doing it and try out something else. You know, that's what I would do. I mean, matter of fact, that is what I've done. um, but getting back on a topic. Um, there's also like an SG B shot, which is um used to often help treat a person that who uh has a PTS D and it's like symptoms, or are they like are the or they have symptoms like of it. Um, Now I know like for me, I did about four of these shots. Yeah, I'm not a big fan of needles. Nor did I really want to get a shot put into my neck. Um, However, you know, I was at like a point where I wanted to try whatever I could try to help, you know, mitigate things, you know, to kind of help me manage what I was dealing with. You know, like I think that it did help out some, um, but like anything like that, there's always like a slight like a risk. You know, I mean, if the needle, if it hits the wrong thing, if it touches the wrong thing, you know, um, so that's why like I wouldn't say like yeah that should be like your first option. No, I me like personally like I don't think that should be like your first like option. You know, like uh I would attempt to like other forms of therapy first. And then if they don't work, then maybe uh talk to your doctor about that. And just weigh the risk in that, weigh the pros. You know, if that's what that you ultimately want to do. Um, you know, there's also like art, right? You know, drawing, painting, and coloring pictures, you know, and like a lot of like other things, you know, modeling things out of a out of a out of a out of a clay, you know. There's like a lot of different ways to engage in art, you know. I mean, for me, like that I know that me working on the matching and tattoos for me and my sister. You know that helped me. You know, get through really a rough time. You know, like I think when I started like working on it was sometime after that my aunt had passed away. You know, and and it's like that I worked on that and I was focused on that. You know, and it's like all of like the like energy, like all the like uh all of the like emotions, like it all went like into that, and so like I was able, to get my mind like off of that. um you know I mean, maybe art isn't, what works uh for you, but um it could work for somebody else. um, and then you have meditation, which is a form of mindfulness. Um, there's apps out nowadays. They even have like a guided meditation. Um, so for me, at like at one point, which I haven't done in like a while, when I would go to bed, I would throw on at Michael oh at Michael Seeley, and that's a form of guided meditation. So what he does is he talks about things and he helps guide you to just lay down and to like drift off and to sleep, basically. um yeah, so like I think that his channel might be under like sleep hypnosis. It might be, but it's on YouTube. um and uh and I found that useful when I was having like my like issues, like winding down at night, going to like bed, and drifting off, um yeah, like I would put on that, and then like I'm all good to go, right? um and then what you could also do um is to listen to instrumental music on like station. For me, like that I use Pandora. It's like even in like a lot of the like videos that I like edit now, that I add like instrumentals. I mean, just as if like nothing else. Like I mean, like that helps you kind of try to like like relax some. Like to where you're not like as like tensed up. But I mean, yeah, I mean, if you really want to like drift off, like I would say, do like that, or like download um like an app. Look for, like they even have like One's on like a YouTube where it's like raindrops, or it's like wind blowing, or it's like waves, or it's like fire burning. Like different things that you can just like listen to and just like focus on. So like the world that's like around you, that it doesn't make as much like as much noise anymore to us. Um, yeah. Um, and so I know I already had a mention of mindfulness, but another way uh to do like a mindfulness is and to engage in yoga. Um, because with like a yoga that you focus uh, your breathing, you focus on like like every pose that you make, and it always goes back to the breath. With each and every like movement. Um, and then again, of course, you could always do the five senses, right? So this is something that I've done when like I'm having like one of my like moments where like I'm overwhelmed, where I'm like overly where I'm getting like a workup, where I'm like overly like anxious and stuff like that, right? So like with this, what I'll do is I'll focus on what I can look at, and then after I do that, then I will focus on what can I touch, if like anything. Then what can I hear, you know, and then what can I taste? Um, so it's going down to like each of those, and with each one, you're trying to calm down, um, to a point to where you are able to function. You're able to talk to what's going on with you, what's bothering you, um, and um, and I'm moving right along. There are books and workbooks that are out there, um, that also help with trauma, that they help us, I don't know, I guess work through the things that are bothering us, you know. Um, so one like book that's out there is The Body Keeps the Score. Um, that's a book that I heard about in when I was in auto patient therapy, and so that book, I was like, yeah, it's a book, whatever, you know. But then I was probably about a couple months or whatever had that went by, and then I'm just like, you know what? Maybe I should actually think about this book, right? And then oddly enough, I'm at the store, and what book do I see? I see that one, So then of course I'm like, yeah, I think there's a sign that I should, buy this book, right? And I made a point to read a chapter every single night. But what that book did was it helped me start to understand, the way that my mind was now actually wired. The way that it once was wired, that when I was growing up, it helped me make sense of everything that was going on, you know? Um, I mean, it's like, it's our body's a natural response, like if that something hurts us, and we, uh, and we like eyes on it. Like, it could be like weeks have gone by, right? And then we start to like walk over that way, and then our brain it makes us stop, and it's like, no, we can't go over there because the last time you did that, that hurts you, you know. So like brain that it, the the brain and the body, like they are like aware of what what goes on, what has happened, even if we can no longer remember what happened, you know, um, which I think is a is a kind of amazing actually, but um another note, like it helps us like understand why certain things might actually bother us, and then we start to think, well, okay, well, when I first was afraid of XYZ was when I was like whatever age, and then so then you start to think more about it, it's like, okay, so then what happened that would make me afraid of that? And then, I mean, you might think of to talk to like different ones. Could be like your mom, your dad, sister, brother, aunt, like uncle, cousin, or even like friend, who might have been like around you when that happened. Um, but I mean, yeah, I mean, it doesn't go without saying, that no, I mean that there's a lot of things that we go through, and it's our brain's job to tell us when something is dangerous. Um, but sometimes that it reacts. So that ends this month's mental health video, and as always, I hope everyone has a safe and a wonderful week.